Good afternoon, everyone. This is Christine again at Health Current. Connie, are you with us on the line?
I am, Christine.
Okay, I think we are ready to get started. I'm going to turn it over to you so you can introduce Crystal, and I'll go ahead and put it into presentation mode.
Very good. Thank you so much, Christine. Good afternoon, everyone, and thank you for participating in today's webinar. We're really excited to have Crystal Collier as a Syndromic Surveillance Program Coordinator with the Arizona Department of Health Services as our primary contact for the Meaningful Use Help Desk for Public Health Reporting Interoperability Questions is our webinar presenter today. She has a lot of great information to share with us, and at the end of the presentation, you'll be able to ask questions. Please feel free to put your comments and questions into the chat box as we're moving forward. Crystal, please prepare to start your presentation.
Thank you, Connie. And I do want to thank both Health Current and Access, and also Myers and Stauffer for reaching out to the Arizona Department of Health Services and providing a platform for us to share some more information about the public health reporting registries available at our agency. We're very excited to share some of the resources and information about our process for the different registries today. And we look forward to working with all of you and really encourage you to use that chat box if you have any questions or to contact us after today's presentation. Next slide, please. Our learning objectives for today are focused on learning about the available public health reporting registries at the Arizona Department of Health Services, learning about active engagement and the three options: registration, testing and validation, and production. And we also want to talk about some of the documentation that our registries provide for your status with active engagement in working with us. Next slide, please. To start, there are a few questions that we usually get, and the first thing we like to do is encourage providers to go to our Arizona Department of Health Services Meaningful Use homepage. On this page, you will find more information about the registries we have available, how to contact us, and additional ways that you are able to work with us for promoting interoperability and Objective 8. Next slide, please. Here is a screenshot of what our website looks like. I will say that we do plan to make some future updates so that we have the most current information available. Right now, this is what it looks like. If you ever have questions for us, please don't hesitate in sending us an email or contacting us by phone. We would be very excited and welcome any of your questions and how we can address those for you. Next slide, please. So on the website, there's a lot of great resources for you. I'm going to point to some of the places you want to pay attention. These are some of the top questions that I get asked, and really the main source of information for any of our registries starts with our Meaningful Use webpage. And so I want to point you to a table that we have which shares some of the different public health measures that are available. And we divide this into different healthcare provider types. So if you are an eligible professional, you're going to want to look at this row for which registries we have available at our agency that you can work with. Next slide, please. So here's an image of what this actual table looks like. This is the most current information we have available right now for which registries you can work with. If you note on that row that says eligible professionals, you will see the Immunizations Registry, our Reportable Labs Registry, Syndromic Surveillance, and the Cancer Registry. These are the available registries that we have, and then you can see on the left-hand side where we divide it by different healthcare types. So again, if you're that eligible professional, you want to look for the registry you are interested in working with us on and see if there is a yes or a no as to whether or not you could register your intent for that registry and work with us. So this table is really important. This is a starting point of finding out which registries are available and which ones you are able to work with as an eligible professional. Next slide, please. I also want to point out right away, like I said, we have a number of ways that you can contact our different registries. If you go to the Meaningful Use homepage, on the left side, there's a Contact Us button. And when you open up this page, you're going to see a list of the different registries that I just mentioned. You will see a phone number and also an email. So if you ever have questions, please feel free to contact our registries and ask those. The first one, the Meaningful Use email and contact number right there, is the one that you will contact for more general questions about promoting interoperability for the public health reporting objective and the registries we have available. If you aren't sure who to contact, this is also a good place to send an email, and I will gladly assist you and connect you with the appropriate registry that can address your questions. So this is just one of the really important things to keep in mind, is how to find out what our email address is and what our phone number is, and this is available on our website. Next slide, please. So again, if you still have questions, I'm going to reiterate this because this is something I hear quite often from folks, is I wasn't sure who to contact. We're available. Anytime you send us that email, we try to respond within 48 hours of a request, and usually we're pretty good about addressing your questions or asking for more information so that we can direct you to the appropriate contacts. We really, really encourage that if you have a question, don't hesitate. Please reach out to us. We are more than happy to help you. And this is the Meaningful Use email address that you can reach us at. Next slide, please. For active engagement, there are 3 different options, and I'm just going to go over real quick what active engagement is before I jump into these, in case people aren't familiar with this term. In next week's presentation, there's actually going to be some additional information provided and some more resources about active engagement. And I encourage you to attend that webinar to hear more. I'm going to give you a shortened version today and walk through some of this with the different options and how they relate to our registries at ADHS. Active engagement means that the eligible professional is in the process of moving towards sending production data to a public health agency or clinical data registry, or is sending production data to the public health agency or clinical data registry. These are not the most common terms, but they're ones you'll hear a lot if you interact with us. And so if you ask us about your current active engagement status, we're happy to tell you which of these options you are in. If you want to start working with us, we'll guide you as to what our process is and how you can do that. And so the 3 steps, as we think of them at ADHS, or options, are the registration. And so I'm going to go over how you can do this through our Arizona Public Health Meaningful Use portal, and you can submit a registration of intent to work with our registries. The second option is testing and validation, and the third option is production. Next slide, please. For option 1, as I mentioned, you want to register your intent to submit data to the public health registry, and it's required within 60 days after the start of the electronic health record reporting period. the healthcare provider must enter and submit the information on the ADHS registration site to meet the following. If they intend to attest to a new public health measure for promoting interoperability, to meet criteria to send to the Arizona Department of Health Services system, if they have software certified for the measures to the electronic health record packages, this is a note that we like to remind folks of, do not always include software that is certified for public health measures, and additional modules may be required. So when you register your intent with us in our portal, we will have some questions that ask you about the type of registry you are going to work with. It's also going to ask you whether or not you have that particular data that we're interested in collecting, and if you meet that criteria. And it's also going to ask if you have the certified software for that specific measure. And those are really important questions that you need to have the answers for to complete that registration of intent. The entire process to submit a registration of intent once you're in the portal should take 30 minutes or less to complete. It's not that difficult if you have already taken the steps to complete all of this information and enter it into the portal. These are the key areas you really want to look at. So this is a helpful reminder if you want to work with our registries. If you have already registered a measure with us in our portal for previous years, you do not need to re-register. If you plan to attest to a new public health measure, you will need to register for that specific measure. So an example would be if you had registered your intent previously for working with us with the Immunizations Registry as an eligible professional, and you wanted to work with us in the future for our cancer registry and that measure, you would need to go back into the portal and update that information. Next slide, please. What are a few of the steps to actively engage with ADHS for our public health reporting registries? So as I mentioned, the webpage is the first step. Review the information that is there. Review that table that I pointed out. And you're also going to want to look at our specific registry pages to see if they've declared their readiness to work with specific provider types. So an eligible professional, for example, or an eligible hospital or a critical access hospital. And then you also want to look to see if there is additional information that is specific for criteria to report to that registry. This is really important to remember to review those pages. And then you also want to look for the registration of intent eligible professional worksheet. This is a worksheet that'll look at some of those questions that I just mentioned and some of the other background details that will be provided when you go to our Arizona Public Health Meaningful Use portal to submit your registration of intent. The worksheet is meant to be a tool, so if you need to ask certain questions, for example, with your electronic health record vendor, or maybe there's a consultant you're working with that knows some of these answers to the questions we're asking, you can use the worksheet to send to them. It's a PDF, and ask them to complete that information, and then when you go back into the portal, you'll have all the answers to the questions we're going to ask. And then again, it should just take about 30 minutes or less, and if you have all the information, hopefully it doesn't take that long, and you can submit your registration of intent to us at the Arizona Department of Health Services. Next slide, please. So these specific registries, like I mentioned, each have their own individual webpage, and this is where you can find some of that information. The image on the screen here shows where you can find more information about our Arizona State Immunization Information System, the Immunizations Registry. where you can find more information about electronic lab reporting, or as we commonly call it, ELR. This is not a public health measure that is available to eligible professionals. I'm just pointing out which registries have web pages and where you can find that information. Syndromic surveillance. This is another registry that currently is not available for eligible professionals. I'm just pointing to where you can find more information about this registry. And our cancer registry, which is another registry available for eligible professionals to submit their registration of intent to. And then below all of these web pages, you will find more information about our portal and that worksheet. So if you just scroll down on our webpage, you'll find more information about registering your intent and a link to our portal. Next slide, please. So as I mentioned, it's really important to go through each of those individual registries and to look to see if they have declared their readiness, or if there's additional criteria you need to meet in order to register your intent and work with that registry for the purposes of promoting interoperability. This example on the screen is one that I took for syndromic surveillance. We provide a status paragraph, and I think this is common across all the registries in the format of how we've set up the pages. So you can look for this status paragraph. And one of the key things you want to look at that I've underlined here is where it says ADHS is declaring readiness to accept stage 3 syndromic surveillance data submissions from hospitals beginning on January 1st, 2017. In that sentence, there's some really important things you want to look for. You can see we have called out our declaration of readiness. You can also find what type of providers that we want to work with. Here in this example, we're specifying hospitals. And then we're also giving you a date for when we declared this readiness on. There's some additional background information and some steps for providers to get started also on our page. But these are the key areas where I've underlined that you want to look at for each of the registries if you want to work with us for promoting interoperability. Next slide, please. Some of that important criteria, I wanted to show you an example of what it looks like. Our cancer registry does have very specific criteria for working with them. They put on here some information about when they declared their readiness, and they've also mentioned on here what type of providers. So they're looking at providers meaning eligible professionals. That's what that EP is standing for. And then they also talk about if the eligible professional diagnoses or treats 100 or more reportable cancer cases in a calendar year, and also if it's licensed under one or more of the following specialties. This is an example, like I said, of the criteria you want to look for if you want to work with one of our registries. If there's nothing listed, there may not be additional criteria that you need to meet. If there is, you want to review this and make sure that you're in one of these specialty categories that is presented here, or diagnose or treats 100 or more reportable cancer cases, for example, before you submit your registration of intent. Next slide, please. So this is where you can find our EP worksheet on our main Meaningful Use webpage. It's called the EP worksheet. You click on that link and you'll get a PDF that you can download and you can share. So this is just an example of where you can find that information. You'll see in that there are some pre-screening questions and some of the ones that are going to ask you about that certified software and about that criteria for working with our registries is also in that worksheet. Then you'll also see there's a link there to register your intent, and that will take you to our portal. Next slide, please. And this is just an example of what the portal looks like when you get into it. So there are options for new users to create an account and submit their registration. There's also a place if you have submitted a previous registration and want to edit or update the account and the registries that you have worked with. And what's really nice about this portal and some of the functionality in it, and I believe I'll have a screenshot here shortly that I will show you, is that when you register your intent and even when you create an account, you will get automated emails from the system. These automated emails are something that you should keep and use as part of your promoting interoperability documentation. The one that's going to be key is when you register your intent, that submission will also send you an automated email. It will have a date. It will say what registries you submitted for. And you do want to keep all of that information on file for audit purposes or for just maintaining information about which registries you are working with and when you had submitted that registration of intent. Next slide, please. There's also, within the portal, there are some pre-registration screening questions, and there's also a disclaimer for the pre-screening questions, and there's also a disclaimer right before you submit your registration. This is just an example, so we do take this really seriously. We want the providers that should work with us and meet the criteria, have the certified software to register their intent for our specific registries. And if you are not one of those providers that is meeting that specific criteria or has that certified software, the screening questions and these disclaimers are to help you consider whether or not you should move forward submitting that actual registration. If there's a registry that you do not qualify for or do not meet the criteria or the certified software is not something you have, we don't want you to submit that registration of intent to us. Next slide, please. And this is, again, just another disclaimer. It's very similar to the first one, and just making sure that you do want to complete that registration. You don't have to complete the entire forms in the portal all at one time. You are able to go back if you need to collect some more information and then enter it before submitting your registration of intent. It will save the information that you have entered. But again, we really want those that should work with us to submit their registration of intent. And if you do not need to or do not meet some of the specifications that I have already mentioned, we ask that you do not submit that registration of intent. Next slide, please. So what is active engagement for option 1? What does our documentation look like? I have a couple of examples for each one of the options. I did make a note on my slides here. This is not limited to what I share in this presentation. There are other examples from our registries. I just wanted to give folks a couple of examples so that you have something in mind to look for when you're working with us. Next slide, please. So this is an example of one of the emails that is automated from our portal when you submit your registration of intent. I know it's really tiny. The slide deck and the recording of this call will be made available and you can take a closer look. What you can see here in this email is there's some information that says specifically that this is a registration of intent for an eligible professional. It has that date I mentioned of when you actually submitted your registration of intent, and it also provides as attachments some of the information you entered into the portal. What's also nice about this for our registries is that when you submit this registration, the registry you registered your intent for, that specific public health measure will also receive the same email. And in those emails, there should be some additional information provided on next steps for each of the registries. This may be an implementation guide. It may give you directions to start testing. It may also provide additional contact information to begin the next steps. So if you do register your intent, make sure to look for these automated emails that contain additional information, and please keep these emails for future status of active engagement, and in the instance that you are audited, you will want to keep these emails and their attachments on file. Next slide, please. Here's an example of a letter. So those emails are something that you want to maintain as part of your documentation. Some of the registries also provide a letter with your active engagement status. Either option is acceptable as part of the documentation we provide for your active engagement status. Each registry does have a different process and a different way they will document your status. This example I'm sharing is from our electronic laboratory reporting registry. It gives some information about the date of the particular letter. It gives some more information about for which specific registry and the public health measure they are working with, and it will also have some additional dates and which option the hospital is working with our electronic laboratory reporting registry with. So this is just an example. Again, it's not the only type of documentation, but it is an example of a letter we would provide with active engagement status upon request. And this one is specifically calling out option 1, the registration of intent. Next slide, please. For option 2, testing and validation, this is after you register your intent and the healthcare provider may start testing and validation right away, or we may place them in a hold queue while we work with other partners. When ADHS is ready to initiate the testing and validation option, we will reach out to you and we will submit an invitation to begin. Dependent on the registry that you are working with, some may be really, really busy, and some may have the opportunity to work with you as soon as you submit that registration of intent. You really do want to look for any communication that we send out indicating next steps for beginning that testing and validation period. The testing and validation process ensures that there is a successful transmission of your data to our registry, and also that there is high quality data received. If a provider fails to respond to requests from ADHS within 30 days on 2 separate occasions within their reporting period, they fail to meet their measure. So this is a really important point to remember, is that if you don't respond to requests from ADHS on 2 separate occasions within a 30-day time frame within your reporting period, you will fail to meet that measure. Now, there are a number of things that we will do to connect with you. We'll send emails. I'm sure there are also phone calls trying to contact you before you fail to meet this measure. We really have good relationships with the providers that we're working with, and we like to maintain those. And we know everybody has busy schedules. We really want to respect the time and the resources that are dedicated to testing and validation. Be present and work with us, and I think all of our registries are very flexible in working with schedules. We ask that our partners also respect our time and our resource needs and communicate with us as well. And so this is just something we'd like to highlight and make sure that folks are aware of. And please, just as a best practice, contact us if you are needing to change schedules or something happens. Just please maintain that contact as to what is going on and if there are any delays in working with us, or if there are going to be future delays that you're aware of. Maintaining that contact and communicating what's going on is really valuable to moving the testing and validation period forward. It's also very important in production. Next slide, please. So what is a hold queue? A hold queue is something that we may use for any one of our registries during the active engagement period. And within all of those options, you may be placed in the hold queue at any point in time. So this may be directly after you register your intent in our portal and you receive one of those automated messages saying that you've been placed in our hold queue, and we will contact you in the future about when we can begin the testing and validation process. It may be something if there are limited resources to begin testing and validation for the registry, but this also may happen for the providers and, for example, the electronic health record vendors that they work with. I think right now during the COVID-19 pandemic, we've seen this quite a bit where resources are really dedicated towards that response and things may be put on hold. And so there is that option of putting in a hold queue. It's there really to support both public health in our registries and also there to assist when there are issues for providers and their electronic health record vendors in trying to work with us. So this is not meant to be a bad thing. This is actually meant to support both the resources and the time that is needed to make the testing and validation experience what it should be, and the product of that moving everyone into production meets the expectations that everyone has and hopefully does so in a timely way. So when you are placed in a hold queue, you do not need to re-register your intent. This is not a new status that you've earned by being placed in a hold queue. It is just a place where you are holding on for us to tell you when we will begin the testing and validation phase. So if you ever have questions, please don't hesitate to reach out. Again, if you already registered your intent, this is where you still want to maintain that registration of intent submission in those emails or any other correspondence you have with our agency and our registries. Next slide, please. Next slide, please. So what does option 2 of active engagement look like? There's some emails. I'm going to show you some examples, some calendar appointments. This is what I mean when I say keep all of the correspondence we have with you. There's an example of an onboarding call, some notes, some emails, and another example of an active engagement letter. Next slide, please. So this is another example of what one of those letters looks like. If you are in the hold queue and you have registered your intent, we usually have something that denotes that you've been placed in that hold queue just so you know where you are with the different options. If you ever have questions, like I said, reach out. And as I mentioned before, not all registries use the hold queue, but they have the option to use that at any point in time. So this is, like I said, just a status that if you have questions and would like more information, we're happy to go over that. This is not a bad thing. This is actually something meant to help support all of us and the different resources and time that should be dedicated to testing and validation. Next slide, please. Here's an example of an immunization status email. So this provides, again, some dates that are important. It gives some information about the onboarding process. It also talks about specific rules and some other specifications for the HL7 messages. And then it provides some additional information about the test message. So this is an example. If you receive one of these emails, make sure you maintain this as part of your documentation. Next slide, please. This is an example of an invitation to a kickoff call, which is where we begin the testing and validation process. And so this is just an email that has a couple of things inviting the hospital partner and the electronic health record vendor to a call to discuss next steps for testing and validation. Next slide, please. Here's an example of a calendar appointment. Like I said, these are all examples of correspondence, and again, it has some additional documents sharing what the implementation guide is, sharing some other questions and resources that are part of the testing and validation process, and some other details about who is being engaged in working with us for this testing and validation period, and it's some of the next steps for what everyone needs to do for their roles and different responsibilities during the testing and validation period. Next slide, please. This is an example. If there are weekly onboarding calls that take place during the testing and validation period, not only do the calls take place, but there may be emails that have notes about that call for different items to follow up on. They might also provide some areas that the provider and the electronic health record vendor may be working on to correct in the HL7 messages. For example, that's what some of this is. And then it's also showing that a provider is responding back to our syndromic surveillance registry in response to our requests. And so this is a good example, again, of that documentation to keep on file. And it's really helpful, like I said, to have these communication channels with our partners where they are very responsive and address the questions that we have and stay engaged working with us. Next slide, please. This is an example of some of the data quality tools that we use. This is from our syndromic surveillance program, and it has some spreadsheets down at the bottom that have a couple of different areas that need to be addressed to improve the data quality. And so this is an example of one of those emails and something that we share with the partners, giving them information about what they need to work on during testing and validation and some directions for how to improve. Next slide, please. And then here's an example for ELR. The concept is the same. Again, just being an email that's saying some areas that need to be improved during testing and validation, and some of the spreadsheets that provide examples where improvements need to be made for data quality. Next slide, please. And here's another letter that mentions testing and validation for option 2. So this is something else that we would provide, talking about where the hospital provider is in the objective. I believe this one is for syndromic, and so this can be used as part of your active engagement status documentation. Next slide, please. So option 3, production. ADHS will notify the healthcare provider when their data is fully validated and flowing to the production system at ADHS. After that, ADHS will contact the provider to resolve any issues with submission or data quality that arise. So when you complete testing and validation, there should be, whether it's an email or a letter, something from our registries telling you that you have transitioned from option 2 to option 3. And then once you are in production, again, we want to maintain that communication channel. And if there are issues, that we let you know what those are and then ask for you to work with us to improve the data quality. So we really like, again, the data that we're receiving. You worked really hard during testing and validation, and once you go into production, we really want you to maintain that data quality and working with us, because your data oftentimes goes to supporting many of our activities at the agency. An example right now is much of the data right now we have received through our registries is contributing to our response efforts for COVID-19. And a lot of that is because our providers have worked really hard with us during that testing and validation period, and once their data is in production, we're able to utilize that for different surveillance activities. So it really does make a difference, all the effort that is contributed during the testing and validation period, and then when it is used, when the data is in production. So it's a process, but it does go to support public health activities. Next slide, please. So for option 3, what are a couple of examples? I think I need to update that bullet before we send out, but there's a go live call as an example, and there's also an active engagement email. Next slide, please. So this is just an invitation where we have a go live call. This is an example of that status we would provide when you have transitioned from testing and validation and moving into production. This is an email saying we want to set up a call. We want to talk about what happens next. And so we're letting the hospital provider, as an example here, and the electronic health record vendor know that we're moving to a new status and what are the next steps and what are the roles and responsibilities of everyone once you are in production. Next slide, please. And here's just an example of one of the calls like I did for testing and validation, just showing that there's going to be a call, some additional information about what the next steps are, and if you're able to hold on to things like this, this would be another good practice to keep some of this information on file. Next slide, please. I think we can go to the next slide. And I have an example here from Immunizations. If you are working with them, this one is sharing an example for the provider of what their active engagement status is. And they do have some dates in here that they will change. So if you're working with Immunizations and you would like to know what your current status is and you want an example of what it looks like for testing, this is one of those that they have provided. Next slide, please. And again, here's a letter that's an example of going into production, saying when the provider has moved into production and has a date as a reference for when they went into production. Next slide, please. I thought it might be helpful to share a couple of questions that I hear often from folks, and I'm going to try to close here shortly. I just have a few more slides, and then we will have questions and answers session. Some of the common questions that I receive are, can I have an exclusion letter? Are you accepting data for X registry, meaning our immunizations registry, for the cancer registry, for electronic laboratory reporting registry or syndromic surveillance registry? Can I submit to X registry even if I don't meet the criteria for administering, diagnosing, or clinically treating that disease or condition? and/or I don't have the certified software to send that data to the Public Health Registry at ADHS. And why do I need to know my reporting period? Next slide, please. So the common question, like I said, is does ADHS provide exclusion letters? And the answer is no. We do not provide exclusion letters. What we are able to do and what is in our scope is to tell you which of our registries have declared their readiness and available at that point in time, and what healthcare provider types may submit data to those registries for the purposes of promoting interoperability. So those first few slides where I went over where to find this declaration of readiness information on the individual registry pages, where to look for that table that I mentioned that has the different healthcare provider types, and how to find out if that registry is accepting data from a specific provider type. Those are the main places we maintain that information. You are always welcome to send an email or send in to call us and ask which registries are available. We try to do our best to keep that information updated on our website, and that is the first place we encourage you to look for this. So again, it's not within our scope to provide exclusions or exclusion letters. We can tell you which of our registries are able to accept data and for what specific healthcare provider type and what are the requirements for working with our registries. On next week's Access presentation, they're going to talk a bit more about exclusions. So if you haven't registered for that webinar, I encourage you to come back next week and hear more information about exclusions. Next slide, please. And here's just an example. If you were to ask us for assistance, this particular provider had asked questions about an exclusion and some other areas. And so we will, again, tell you which registries are available, and we will indicate in there that we do not provide exclusion letters. And then if there's any other resources that we can point you to, we try to provide that information as a resource. Next slide. And then here's an FAQ, and actually I think there's another link in the slide deck that I think is helpful for some other FAQs about the public health registries from CMS. So I know in the past there had been some questions about whether or not a provider can register their intent after the first 60 days of the reporting period in order to meet the measure if a registry becomes available at that date. And so this explains that at any point in the calendar year, I apologize, my screen just went off. At any point during the calendar year after the initial 60 days, a provider may still register their intent to report to that registry to meet the measure under active engagement. However, a provider who could not report to that registry may still exclude for that calendar year if they had already planned to exclude from that registry and ready to allow for registrations of intent within the first 60 days of the reporting period. So there's a lot of information currently and in the past about some of this, and I encourage you to look at some of those FAQs. If you have questions, they're useful for answering some of these questions. I know some of the primary ones focus about the reporting period, and this is why I said it's important to know what your reporting is, what the dates are, because they do play a role in when you are supposed to register your intent. So those are really helpful things to keep in mind. Next slide. And then we just have a summary of some of the documentation for active engagement. We went over some of the email examples, some of the letters for registration, testing and validation, and production. And so we just provide a summary table here as an example. I'm going to go to the next slide. And here's just some more information that we had reference from CMS to support any documentation needed for audits. I would encourage you all to look at this. There's a lot to read on the screen. So come back and look at our slide deck and also review the recording. Next slide, please. And again, this is just some information about audits and what you should keep in mind and some examples for those. So just remember to look back and again, join Access's call next week. And I think that's the tail end of most of my slides. And I want to leave a few minutes here in case there are questions.
Thank you, Crystal, for sharing the information about the Objective 8, Public Health and Clinical Data Registry Reporting Part 1. And as Crystal has made crystal clear, we have another webinar that will be presented on the same subject next week. So I encourage you all to participate. Christine, do we have questions in the chat box?
We have not received any yet, but just a reminder to folks that the chat box is open. If you'd like to type your questions in, we'll be happy to read them for Crystal and the team to answer.
I know this was a lot of information and it may take folks a little bit of time to digest and review. So the email address we have on the slide here is to contact our Meaningful Use Help Desk. So it's meaningfuluse@azdhs.gov. You can submit your questions at a later time. You also can call us. Our number is on the contact page. And as we said in the beginning of the presentation, I'm your primary contact and I'm the first one to see those emails and respond to the phone calls. So if you have questions, please feel free to share those with us. There's also some additional resources and contact us information within the slide deck to make it easier for you to submit your questions. So we always have, well, I think they're always great conversations with our providers and our different partners in working with the electronic health record vendors. We always learn a lot from talking to providers, and we're really there as a resource to answer their questions. So please don't hesitate to reach out. We really enjoy speaking with you and sharing information and hopefully working with you in the future.
Thank you again, Crystal. Again, the chat box is open. I haven't received any questions or comments, so we'll give everybody a few more minutes to type those in there. I know sometimes that can take a little more time than just opening up all the lines. Well, we are just before the 1 o'clock hour. I'm not seeing any additional questions coming through the chat box. Crystal, any final thoughts, or Connie that you would like to share?
I don't think
I would like to thank, go ahead, Crystal.
I don't think I have any other thoughts, but just really appreciate the opportunity, and hope this webinar will be a resource for folks to go back and visit for their questions about working with our registries at the Arizona Department of Health Services. And just thank you again for giving us this opportunity and platform to share a bit more about working with us.
Crystal, thank you for doing it. It was very, very important, I know, to a lot of folks that are in the process of participating in the PI program. So thank you very, very much for all the important information. And thanks to everyone on the phone for joining us. And Christine, I think you have some final words to say about what's available to those on the call.
Okay, yep. Let's see here. Thank you again for participating in today's webinar. Each of you who have registered and participated in today's webinar, the slide deck and the Q&As addressed during the call will be sent out. This has also been a recorded call, and we will post it along with any other questions that were received after today's webinar concludes. Again, thank you, and thank you Access and ADHS for participating today. And thanks everyone for participating. Have a wonderful rest of your day. Stay safe out there.
Thank you.